So for my patients who have not had good success with more conservative measures such as oral medications or injections, I talk with them about the penile implant. And we make an assessment together, talk about their other medical issues, their surgical history, to determine whether or not they're a good fit for it. I have them see pre-op anesthesia counseling to make a full assessment of their overall health, check their cardiovascular health, check things like their blood sugar, for diabetes, just to make sure they're overall in good shape for surgery. And then we discuss together whether or not we should proceed with it based on that assessment. This is definitely a concern for many patients, and fortunately, most insurances cover the penile implant surgery, which is great news. So generally, there's two different types of penile prosthesis available in the United States. One is called a semi-rigid or malleable prosthesis. Basically, this is a metal rod covered in plastic or silicone coating, and so it's always somewhat firm, and you bend it up and down into position whether or not you're engaging in sexual activity. The inflatable penile prosthesis is one where you pump it up in order to achieve the erection, and then you can deflate it and it kind of goes down like a balloon so that you can have it tucked away when you are doing your day-to-day activities. During the procedure to place the implant, I measure from the inside of the penis how long the actual penile anatomy is, and I give you the largest one that we can fit into your anatomy. So the cylinders of the implant are inside the penis, and those fill up with fluid or saline, and you use the pump that is in your scrotum to pump that fluid into the penis. And so you pump the pump in your scrotum several times to inflate the device inside your penis. Ejaculation and sensation remain the same as what they were before your penile prosthesis surgery. So if you had trouble with ejaculation and sensation prior to surgery because of diseases like diabetes and like diabetic neuropathy, then those won't change. But if you had normal sensation and ejaculation before, then those will remain normal afterwards. Generally, unless someone is very up close and personal with you, no one's going to know that you have an implant. But certainly if someone is being sexually active with you, they may be able to feel that you have the device the pump in your scrotum. The implant is made of medical grade plastic and has been tested many times, including prior to implantation. The solution inside the implant is sterile saline. On the day of your procedure, you'll come in early in the morning usually and meet with the anesthesiologist, get changed, and when you're ready for surgery, we take you in, put you under anesthesia. There's a small incision that's made either above or below the penis, and then the cylinders are placed inside the penis. The reservoir is placed under the abdominal wall or next to the bladder, and then the pump is placed in the scrotum. It's normal to have some pain after surgery, and I tell my patients that most of the worst pain is in the first 2 to 7 days, and then it gets better after that. I also have them restrict their activities for about 4 weeks, any kind of heavy lifting over 10 to 15 pounds, strenuous activities like working out, squatting, running, and things like that. So I most often see patients about 3 to 4 weeks after surgery, and if they don't have any continued significant swelling or any other risk factors, then they can potentially even start using it about 3 to 4 weeks after surgery. So the penile implant is just like any other mechanical device. It can have wear and tear on it, And I generally quote patients about a 30% revision rate over 10 to 15 years, with some patients needing revision sooner and some not needing it for longer than that. The satisfaction rates for the penile implant are very high, so upwards of 80–90%. Sometimes there are other factors at play, including partner issues or other medical issues, but generally the satisfaction rates are very high. So there are risks to every surgery, and generally these are, you can have a risk of infection, so about a 1 to 2% risk of infection. In the penile implant, however, it's a little bit more a risk, because if you have an infection, it may need to be removed and then washed out and then replaced. There's also a risk of bleeding. Generally, there's not a significant amount of bleeding require any blood transfusions with the surgery though. There's also, like I mentioned earlier, wear and tear of the device over time, so there's a risk of needing revision of the prosthesis if there's a malfunction of part of the implant. That isn't dangerous, but it will mean that you'll need to have it revised in order for it to work again. You can also have risk of injury to the surrounding structures that we're working around, and so this includes the urethra, where you're urinating from, next to the bladder, where we may be placing the reservoir as well.